I then talked her over the phone of a couple simple objective tests to help me clue in to think, does this person actually have a stress fracture or not? And the first test I had her do was stand on one leg and then also take pressure off. And as she was doing that, I asked her a couple questions. First, how does it feel to shift weight onto that leg? And then also, when we're done with the test, how does it feel to shift weight off the leg? So she told me that when she was shifting weight onto her leg, she felt the moment of pain. And then when she took pressure off the leg, she felt that moment of pain again. That is a sign of a femoral bone stress injury or a hip bone stress injury. Just based off of her saying that, I'm thinking this lady has a hip bone stress injury. But I had one more test for her that I kind of talked her through. So the classic test for ruling out a bone stress injury is to jump on one leg 30 times. I told her over the phone, okay, now what I want you to do is jump 30 times on that left leg. Do you think you can do that? And she said, no way, not a chance. I bet I couldn't even do one. That's gonna hurt. So number 4 was apprehension to jump on one leg. She said, no, there's no way. I think that's gonna hurt. That doesn't necessarily mean that she has a bone stress injury, but it really, with all of these things put together, it really makes me think this lady probably does have a bone stress injury, and we need to rule out bone stress injury before I can actually see her in the clinic.